My name is Andrea Davis, and I am a board-certified art therapist here in Dallas, Texas. And I founded an organization, a nonprofit organization called Dallas Art Therapy. Dallas Art Therapy started in 2017 to fill a gap in need for the community. Art therapy is a type of therapy that is not easily found in Texas, and we really wanted to help people have access to art therapy care and also have a place for art therapists to find work in our city. In our organization, we serve people that have experienced trauma or are experiencing depression and anxiety, sometimes grief and loss. That's our specialty in this organization, but art therapy in general can serve a wide variety of populations, from people that have been in service and are veterans, working with PTSD, to people that have medical issues, hospitalization, surgeries, things like that, as well as mental health. And also, an unexpected way you'll find art therapy is in museums and in the community, working with general populations. One of the special things about art therapy is it can use your whole mind, body, and spirit in expression. So you will physically be making art, and in the ways that we provide services, we have a couple of groups that adults can come to. One of them is SOS, it stands for Sarah's Open Studio, and it's open to the public and free to attend one Saturday a month. And we also have another one. We partner with another organization called Foundation 45, and we offer another free to the public group for adults as well. And so the people that come to that group can expect to find certain kinds of art supplies to use. So we select certain supplies that evoke certain kinds of experiences in the body. So you might, for example, using a pencil, feel a bit more in control. Using loose things like paint or wet clay, you might not feel as much in control, or watercolor, for example. So depending on what goals we're having for the group, we might choose one material over another, so for the care of the client. So let's say if we're going to go into a sensitive topic, let's say like grief exploration, we might choose more controlled materials to help group members that attend feel a little bit more in control of their feelings and emotions than they might if we had given them watercolors. It's really interesting, but these kinds of kinesthetic and sensory motor experiences are very much attached to how we feel in our bodies and how deep we go in our artwork. And we really want to create a safe environment, a non-critical environment for people. And so that's one of the things they experience with Dallas Art Therapy, is being able to have that experience free of charge. So sometimes people worry that they have to be an artist or be trained to be able to participate in art therapy, but the truth is that you don't have to have any experience in art making, and an art therapist is trained to guide you through step by step, exploring art materials and finding which ones are the best ones to help you express what you need to express. So it's because it's a non-judgmental, non-critical environment. You can feel safe at whatever level you're at. So people that have lots of experience making art versus people that have not made art since they were in grade school are welcome and are just fine and should feel comfortable to make art together with an art therapist. Right now I am working on some needle felting. It is, you can see, really simple. I just use a needle and just make a little poking motion into some wool, and I work with it to kind of make a shape. This one is going to be a pumpkin for October. So it's pretty simple. Anybody, I think, can learn it. I've taught many people how to use this technique, and everyone's been successful. No failures yet. So I think you should be pretty comfortable doing things like this. Just take colors and kind of just poke them into place. And when you're making this motion, it can be kind of a soothing feeling, especially if you're nervous or you're having some anxiety. Just making a repetitive motion helps the body calm and relax. And so this is one way that art making can be helpful to regulate emotions and reduce feelings of stress, maybe anger. If you want to work in a flat capacity, we have little foam bases, and I love the sound that it makes. It's like a crunchy sound when you work on the base. So this is a more quiet one, but sometimes we work in the crunchy zone. So that's one way to make art and use your art for expression. So I'm going to show some other materials here. I have some paper here, and I have some oil pastels. And just drawing on a paper with oil pastels can be a really great way to get out your thoughts, feelings, emotions in an image. So one way that we might do this would be to just make a picture of what you're feeling today. So kind of checking in with yourself and saying, how do I feel today? If I'm feeling a little bit maybe worried about someone who is experiencing a health issue, or maybe an argument I had with someone, I can kind of address that in the colors, shapes, and lines that I choose for my artwork. So let's see, I'm going to choose this green color, and then I'm going to make some marks on my paper that show kind of how I'm feeling. So if I'm feeling like really angry, I might make more sharp lines to kind of make harder lines on my paper. If I'm feeling kind of relaxed and calm, I might choose to make some more flowing, lighter energy lines. So however I choose to express myself is right. There's no wrong way to do that, unless it doesn't feel like you're being true to yourself. It's really up to you. So you really can't fail at this. You're just going to express how it feels and just get that out. And once you have it on the paper, then there's a visual that you and the therapist can both look at together and experience together and witness together, and then talk about if there's any words that need to be expressed. Art therapy in general is a nonverbal way of doing therapy, so you don't really have to say anything about the art. It speaks for itself in many ways, but sometimes it is a wonderful bridge to language and bringing words that you didn't have access to before that may be at a deeper level of meaning than just what comes to mind. So another great thing about art therapy is that for people that are younger, that may not have developed a very rich vocabulary or even the brain development to express deeper levels of meaning, they can access those with their artwork. And so it's a really wonderful tool for younger people to express as well. So going in another area, so let's say if these feelings are just so raw and painful that pretending that I'm needing an art therapist to guide me here, maybe the art therapist will question, like, what does your art need? And so I have a little tray full of colored tissue papers here, and maybe I'll use these to help create like a little boundary and a comfort zone to kind of contain those feelings that maybe don't feel so good, and maybe I want to transform them a bit into like a healthy expression. Instead of maybe some harmful things that could come from this anger, I can transform it into a more healthy and productive, meaningful experience. So that would also involve exploring. So say if this anger made me feel like I wanted to do something self-destructive or hurtful to others, I can explore maybe what's another way that I can meet my needs for expressing my anger without harming self or others. So using this process, I'm activating my mind, body, and my my whole spirit to explore those thoughts and feelings by bringing them up into myself. So I'm going to choose some things that might be comforting to my artwork. So these little tissues, I'm not going to cover up the anger, but I'm going to kind of maybe use it like a soothing agent here. That maybe these are like little like colors that are going to bring in, and I can see the colors kind of transforming here. So I can explore, what does that mean for me when that transforms? Wonder what it could be. And the client can kind of talk about, like, what would that mean for you if you had a healthy way of expressing? What would that look like for you? Would it mean going to your art journal and drawing some personal artwork for yourself? Would it mean taking a walk in nature and spending some time just breathing and relaxing and not confronting or doing anything about what's happening, just taking some time to think? What would that mean for you? Because everyone's different. Maybe some of this anger is important, because anger is such an important feeling. It doesn't always feel good. It doesn't usually feel good, but it is definitely an important part of being a human, because if we didn't have anger, how would we know what things are not okay for us? How would we get that message from things that happen? So we kind of need anger, even if it doesn't feel good. So how is this anger trying to help me and trying to protect me? I'm getting the feeling that covering this up is kind of like a band-aid, like a protection. So you can see how the art's leading me in that direction with my words. And then once we come here, we can sit with the art a bit, and then if it has any more messages for us, we can go in that direction, but it's really according to the person and what they're experiencing. So. Yes, so for SOS and Foundation 45 groups, they're for adults, so 18 and up. We do also have an art club, which meets on 1st and 15th Mondays for teens, and so that's 13 to 17. And then we don't have any current groups for younger kids. Every once in a while I offer some specialty groups. Annually we'll have groups that are special for maybe boys ages 8 to 10, or kids that are going through the foster adopt process, special groups like that. So we do offer services for school age up to however old a person can be. So art therapy is really for everyone. We provide art therapy in individual therapy, filial therapy, which is a fancy word for parent-child working together, and group therapy. And then we also do work in the community. So yeah, there's a lot of ways to do art therapy. So if you want to work with an art therapist, you're going to need to find someone that has special credentials. And there's a funny story about these credentials. So it's ATR, which means Art Therapist Registered. And it seems like it might sound better to be Registered Art Therapist, but then it would be RAT, right? R-A-T? Yeah. It's kind of funny. But if you want to find an art therapist, you can go to the American Art Therapy Association website, and they have a Find an Art Therapist locator. There's also a local organization called North Texas Art Therapy Association, and they also have an art therapist locator. But looking for those credentials is going to be really your security that this person has been trained, because art therapy is a master's level job. So you have to have completed your master's and 2 years post-master's internship with a mentor. So if you don't see those credentials, then you can't be sure the person has had the education. Thank you for tuning in and learning more about art therapy. If you'd like to learn more about Dallas Art Therapy, you can go to our website at www.dallasarttherapy.org, or you can look us up on Facebook, Instagram, and LinkedIn.